Hi, Tiffany Matthews, the patient guardian here. I'm also founder and CEO of Live Better Boomer Healthcare Advocacy. I wanted to talk to you for just a minute about why I started LBB. My grandmother, Elnora Farmer, she was very gravely ill in 2007 and 2008. And I was a social worker and discharge planner in a hospital, but it was across the state. And she, knowing that she was gravely ill, I tried to do anything and everything that I possibly could. I mean, this woman was a second mother to me, and saved me from a lot of butt whoopings. But when she was ill, the hospital social worker came to her and said, "Oh, your insurance is up. You're going to have to go home." Well, she had a trach. She didn't have test results. She didn't have a safe place to go for 24-hour care, and my family wasn't qualified to do that because it was so serious. And my mother was extremely exasperated and called me one day and said, "I'm going to jump out of the first window I see." And I said, "Why, Mom?" "Well, the social worker is saying we have to take Graham home and we have no way to care for her." These hospitals and these facilities, if you don't know what you're speaking of, they will push you around any way that they want to because they expect you to just follow suit in what they say. I was part of the machine. I know. I've done it. And I don't want to do it anymore because healthcare is about profits. And whatever patient is sickest and gets the most attention and needs the most care is the one that they want to fill their beds. Beds have to be filled. So I was surprised that they were trying to get rid of my grandmother, but because she was gravely ill. But I called that social worker and I told her, I said, "Sweetie, let me tell you something. I play the same game as you across the state, and I've put out grandmas and grandpas telling them that they basically have to do what we tell them because their insurance is up." Well, it wasn't going to happen with my grandmother. It really didn't hit home for me about what I was doing and what I was participating in until it happened to my own family. You have to walk a mile in someone's shoes to understand what they're dealing with and what they're going through. And it was then that I decided I know more than this and can give patients more than this. Patients have ways to stand up. For example, that paperwork that they give you when you're admitted to the hospital, read it. It's boring, but it's important that you read it. Those will give you rights that you have. A lot of people that don't look at them don't know, and they're just shoved around. So I told that social worker what I was prepared to do because I played the same game as her every day. And I hung up saying, "Have a wonderful day." My mother called me back an hour later and said, "Did you threaten her?" No, I didn't threaten her. I simply told her what she needed to know in order to do what she needed to do. But why do families even need to go that far? And what about the families that don't know about this type of thing? It's awful. And that's why I dedicated my career to helping patients and families learn the system, use the system correctly, stand up for themselves, and at the same time save money, time, and stress. I do this for individuals and families. I work with groups. I want to work with companies as a health and wellness program, and these companies could benefit from increased attendance, increased productivity, increased morale, while also saving money and time for their employees and themselves. So there's my story, and my grandmother got what she needed that day. Does your family have what they need healthcare wise? If not, please call me. Let me know. Again, my name is Tiffany Matthews. I am founder and CEO of Live Better Boomer Healthcare Advocacy. You can go to lbbhealthcareadvocacy.com and check out the great things that we do for individuals, families, and companies. And I work with companies in order to reach the masses in a quicker, more efficient way. So I thank you for listening, and I'm hoping I can help you or show you yourself what you need to do to be able to take on healthcare these days. It's a broken system. The only way that it's going to get fixed is if patients stand up, and I'm here to help you. Take care.